Hi guys, welcome. Let's study together. Why? Well, it's easier and more fun. You're going to be more efficient. Repetition is the key, right? And you're going to get some free study notes at the end of each block. Okay, let's move on and see what to expect. So you're going to have 5 questions per each block because I don't want to make these videos too long. So 15 to 20 minutes per block is sufficient. There's not going to be any computer reading. I found those extremely annoying, so you're going to enjoy my pretty accent. There's no fancy formatting because you're not going to have any on your exams, so I want you to get used to the white background. You can pause anytime. Think longer if you need to, but I'm going to give you 5 seconds to pause, read, and answer your question. And after that, we're going to have an explanation and a discussion about the correct and incorrect answers. The discussion is going to be quite focused, so if you do have more questions, please feel free to pause them. I'm going to make sure I get to them. Okay, here's your 5 seconds. Okay, so in order to answer this question correctly, of course, we have to begin with the most likely diagnosis. So let's see what we're dealing with here. We can see that this young man is showing excessive daytime sleepiness. He also has sleep paralysis, and he's got sleep attacks. At this point, I think it's more than enough to say that the most likely diagnosis is narcolepsy. Okay, what do we treat it with? Modafinil. All right. So modafinil has become a first-line pharmacologic therapy because it provides a good control of sleepiness, and it's quite well tolerated. And illicit use is rare. All right. Let's get to incorrect answers. Nortriptyline is a no. It's used in depression. Diazepam is a no. It's a benzodiazepine. It's used for anxiety, seizures, and muscles. CPAP you can exclude right away because it's a treatment for sleep apnea, and this patient obviously doesn't have any signs or symptoms of it. And now let's get to fluoxetine. Fluoxetine is used in depression as well, so you may exclude it on the same basis as nortriptyline. However, I want you to memorize something else. Okay, fluoxetine is a REM sleep suppressing medication, and it's actually used as the first line therapy for cataplexy. Okay, so let's connect these two and these two. All right. Let's get to question number 2. Here comes your 5 seconds. Oops. Okay, so just like in the previous question, we have to see what we're dealing with first before we associate it with the culprit. So let's get to it. What do we see in this patient? We see mild fever, fatigue, rash, and what else? Sore throat. Okay, so I think at this point it's more than enough to think about mononucleosis. What's a giveaway? It's rash after giving amoxicillin, and she has never had the drug allergy before. Alright, so mono. What do we connect it with? EBV. So that's an easy connection. Let's see how we're going to exclude the other choices. Okay, so in this one, the easiest ones to include first are A and D. Okay, so Staph aureus can cause different kind of illnesses, from minor skin infections such as pimples, boils, cellulitis, folliculitis, some abscesses, to life-threatening diseases such as pneumonia, meningitis, osteomyelitis, endocarditis, bacteremia, and sepsis. So obviously this patient does not show any signs or symptoms of any of those, and on top of that, the vitals are completely normal, so we're not going to go to sepsis. Then choice A is group B streptococcus. So group B streptococcus usually causes infection and is associated with human genital and GI tracts, and then the upper respiratory tract in young infants. So basically, it's an important cause of infections in three populations: neonates, pregnant women, and non-pregnant adults. So we're not going to talk about the first two, but let's cover the last one just to mention it. So GBS is a cause of bacteremia without a focus, sepsis, soft tissue infections, and other focal infections in non-pregnant adults. Again, this patient doesn't have any of those, so it's highly unlikely to see this bacteria connected to the patient's condition. The next one to exclude would be strep pyogenes. Okay, so they want us to think about pharyngitis in this case. However, it's less likely than mono, obviously, because first of all, it should respond to amoxicillin, at least at some kind of response. We should have seen it. However, the patient got rash, and that leads us to another diagnosis right away, okay? Now, allergic reaction to amoxicillin is also a really good choice here, and we should exclude it right away so we can remove any kind of confusion. So let's see, the patient has never had a drug reaction before. Okay, that's one minus. And then we can see maculopapular rash on her trunk and marked pharyngeal erythema. Okay, so that should kind of lead us away from answer in the choice E. So we have to connect the macular erythematous rash after amoxicillin, which is usually tan or brownish in color. That's mono. Because this rash that actually shows an allergic type rash, it's super red, okay? So we would get a different description of it. All right, I hope this helps. Let's get to question number 3. All right, again, let's get to diagnosis. What do we see here? Repetitive grunting noises, okay. Frequent eye blinking, okay. Hyperactivity, impulsivity. So all of this makes me think of tics. Okay, tics are the clinical hallmark of Tourette Syndrome. Tourette Syndrome, the onset of it is typically between 2 and 15 years, and the features include motor tics, vocal tics, and some other behaviors. So the common motor tics are eye blinking, shoulder shrugging, mouth movements, head jerking, nose twitching, facial grimacing. You can see all of those in the patient's presentation. And then we have common vocal tics, throat clearing, coughing, grunting, sniffing. And on top of that, some other behaviors might be included as well. And one of these other behaviors is actually our correct answer, okay? Which is corpulalia. It's an involuntary and repetitive use of socially unacceptable words. So these include saying vulgar words, making vulgar gestures, repeating words, etc. Tourette's is usually asked about on the exam, so make sure you know it. So you know the presentation and you also know the comorbidities. I'm going to mention these in the summary at the end of the block. Okay, regarding the incorrect answers, let's exclude the easiest ones, okay, which is paralysis. This may happen in a somatic symptom and related disorders. However, the child usually presents with stomach ache, headache, nausea, vomiting, or something like that. It's highly unlikely to present in this manner. This is a typical Tourette's. Unwillingness to go to school. Okay, well, this is a child with separation anxiety disorder. They may have an unreasonable fear of school, and they would absolutely do anything to stay home. Again, we see none of these in the patient's presentation. And now we have to exclude the last two. Alright, and these actually lead us to think of conduct disorder, which may later develop into psychopathy or antisocial personality disorder. And all of these are actually connected to one of them. Okay, the easiest thing for me to remember is the McDonald triad. I know it's not accepted by some scientists, but for me and my memorization, it helped a lot. So, sociopathy or homicidal triad links cruelty to animals, obsession with fire setting, and bedwetting past a certain age. Okay, that should be it. Here's your question 4. Alright guys, the correct answer is E, needle thoracentesis. Okay, I'm not going to go into detail with this question because you're going to have to do question number 5, which is similar to this. So let's just discuss the correct answer. Okay, what do we have here? So we have a patient, a trauma patient after VMA with shortness of breath, chest pain, rapid heart rate, rapid and shallow breathing. Okay. The neck veins are not distended yet, but look at this. He is getting worse. Alright? So we have the neck vein distended, we have hyperresonance, we have absent breath sounds, we have a patient in distress, and we can't do any of these. We don't have time for it. Therefore, we have to diagnose him and treat ASAP. Alright? So make sure that you have to know how to detect these emergency life-threatening conditions in the primary survey. So you have to figure out if the patient has any of these before you choose the treatment and choice. So you have to exclude airway or include airway obstruction, tension pneumothorax, open pneumothorax, massive hemothorax, flayed chest, and pericardial tamponade before you proceed and manage the patient. Here's your last question in this block. Okay, so what do we have in this patient? You should be able to recognize so-called Beck's triad. Okay, so we have JVD, we have hypotension, and we have diminished heart sounds. Okay, the breath sounds are fine, but the heart sounds are distant, and the pulse is faint. What do we think of? Cardiac tamponade. Okay, what do we do? Pericardiocentesis. That's a must. So basically, supportive care with fluids may prove beneficial, but only for a short period of time. Cardiac tamponade is accumulation of pericardial fluid under pressure. It occurs within minutes in trauma, especially the penetrating trauma. It usually results in a picture resembling cardiogenic shock, and the urgent reduction in pericardial pressure is a must. So patients suspected of having cardiac tamponade should be evaluated with electrocardiogram, chest radiograph, and echocardiography, but not in this patient. This patient has to be treated right away. Okay, so we don't have time for any of those. And see, and there is needle, thoracentesis, which is used in treatment of hemothorax or pneumothorax. However, we can see that this patient breath sounds are clear to auscultation. Chest percussion notes are normal. Okay, so pneumothorax is highly unlikely provided the other findings in this patient. So there's no hyperresonance and percussion. There's no trachea deviation. There's no chest asymmetry. There's a stab wound. So it's a clean-cut cardiac tamponade, and the treatment and choice is clear. Here's a little summary of the correct answers if you want to keep track by category. Okay, so here comes a quick summary. It's time for screenshots. Here's one on Tourette's. And make sure you know the flower. That's a big one on exams. Okay, this table is a big one as well, so make sure you know every single cell in this table. And let's not forget narcolepsy. Thank you guys. Let's go to the next block.